Hi, my name is Corrine Harrison, and we have a client by the name of Mary Smith, who at 5:30 a.m. has not had been unable to void rather, or been able to urinate. She has orders to have a bladder scan done should it go beyond 4 hours, which was done, and it was noted that she had 400 milliliters of urine in her bladder at that time. So going back to her order, she also has a order to have an intermittent urinary catheterization should she have more than 200 milliliters of urine in her bladder. So again, going back to her orders, she went over 4 hours without having urinated, and she also has more than 200 milliliters of urine in her bladder as per the bladder scan, which was done. Therefore, she needs to have an intermittent urinary catheterization done. So I have my supplies here. It's an intermittent urinary catheterization tray, and the expiration date is December 3rd, 2023. We also have the sterile gloves here, which expiration date is December 8th, 2023. We have our clean gloves and also hand sanitizer. And again, going back to Mary's orders, she has gone beyond 4 hours. She has more than 200 milliliters of urine in her bladder as per the bladder scanner, and she has no known drug allergies. So we're going to go ahead and introduce ourselves to Mary and explain what it is that we need to do. So I'm going to come in, pull back the privacy curtain, perform some hand hygiene. Hi Mary, my name is Corrine. Can I just verify your name and date of birth? Okay, medical records say Mary Smith, and your name badge says Mary Smith. Medical records states your date of birth is 4/27/1976. Date of birth is on your bracelet is 4/27/1976. So Mary, again, I know that you made us aware that you had not been able to urinate, and this has started since 5:30 this morning. We did the bladder scan, and we noted that you had more than 200 milliliters of urine in your bladder. Now the doctor has left orders for you to have what's called an intermittent urinary catheterization done should you have more than 200 milliliters, and right now you have 400 milliliters of urine in your bladder. So do you have any other questions? No? I know that you have no known drug allergies, but I'm just going to walk you through the procedure as we go through it, and should there anything arise, just let me know. I'll be here with you. Okay, so I'm going to go ahead and have you lay back into a supine dorsal recumbent position. I'm going to lay her back, and I'm going to provide her privacy with placement of the sheets, exposing her urinary meatus. Okay, now I'm going to perform hand hygiene again. And I'm going to place some clean gloves on. I'm going to take a washcloth with some soap, and we're going to wash from the clitoris to the anus. I'm going to dispose of that. I'm going to take off the gloves and also throw those in the trash. Now we're going to go ahead and perform more hand hygiene. Then we are going to open the urinary catheter tray. Now we have the drape here, which I'm going to only touch the two corners. Mary, I'm going to ask that you raise your buttocks slightly up off of the bed. Only touching two corners. I'm going to place the drape underneath Mary's buttocks. Now I'm going to return to the sterile kit. Open it completely. Then we are going to take these sterile gloves. And open up the sterile gloves. I have my sterile gloves in place. I'm going to go ahead and rearrange my items as needed inside of the kit. We don't need this. I'm going to go ahead and open the swabs. And I'm going to go ahead and open the lubricant and placing that down into the tray. I'm going to place the tip of the catheter into the lube and let that sit there. Now with my non-dominant hand, I'm going to, Mary, now I'm going to go ahead and clean your urinary meatus. Yes. Okay, so I'm going to use one swab. I'm going to clean from the majora from front to back. I'm going to clean the near linear jaw from front to back, or clitoris to anus. And I'm going to clean straight down the middle. I'm going to throw those in the trash. Okay, Mary, now I'm going to insert the catheter. And when I insert it, I'm going to need you to take a deep breath and bear down as if you're urinating. Leaving the tip of the catheter into the tray. I'm going to move closer. I'm going to insert about an inch until about 2 inches. And once I start to see some urine, I'm going to proceed another inch. And I'm going to allow for the urine to drain into the receptacle. And once that is completed, okay, Mary, I'm going to go ahead and remove the catheter now. I'm going to place that all into the tray, away from Mary. I'm going to use the drape and clean the excess betadine from her, provide her with some privacy, and dispose of the gloves and the drape all in one. And I'm going to throw that in the garbage. I'm going to perform some hand hygiene, and now I'm going to document.